All right, let's join Abubakar Musa live from Meru County to give us more insight as to what other measures have been taken. Abubakar, from your report, we're seeing the intervention of the state, but what other preventive measures or communities you mentioned in that report have adopted to prevent this disease?
All right, thank you very much, Ruth. It is no longer news that there are reported cases of acute watery diarrhea in some parts of Maiduguri Metropolitan Council, Jere and Konduga. The focus right now is how best to prevent further spread of the disease. So Borno State government summoned an emergency meeting with critical stakeholders in the health sector for a coordinated and prompt response. Series of far-reaching issues have been deliberated upon, where a strong and comprehensive response plan was actually rolled out. However, 100 persons have so far been affected by the acute watery diarrhea, with 7 deaths recorded. The 100 persons that have been affected by the disease are not only receiving treatment and responding to it right now as I speak to you, but they are being monitored closely. They have been isolated. In fact, they've been taken to a very large facility being run by a non-governmental organization, Medicines Sans Frontiers. Also, in order not to take chances, the infectious disease hospital situated in Jimtulu at the outskirts of Maiduguri and a public health emergency operations center have been activated. So generally speaking, Borno State government and development partners are actually on top of the situation.
All right, Musa, and you know diarrhea could be triggered by different, substances, but for the communities, I'm sure you've interacted with them, are they also doing their own part to prevent the disease?
Yes, I was able to speak to the Permanent Secretary of the Ministry of Health yesterday, and he told me explicitly that they have carried out, massive enlightenment campaigns to sensitize the communities, especially those that are very vulnerable, to take precautionary measures, especially in the area of maintaining personal hygiene practices to stay safe.
Thank you very much, Abubakar. Let's hope they will be safe. Thank you.